Hey everyone, it's Chris here. I'm getting a bit pissed off because this is like the 6th or 7th time I've tried to do this video and it's becoming pretty tough now. Today is the 6th of November 2012 and today I had my first opinion for chest surgery. I live in the UK, I live in England more specifically, and I go to Leeds Gender Clinic, and I had my first opinion there today. By the way, my voice is a bit high. That's because I'm tired. I'm pretty knackered. I've had a full-on day. So trying to record this video is pretty tough. I've noticed that the more tired I get, the more high my voice goes. So yeah, just to point that out, I can't wait till it fully drops off, because it will be pretty good when it fully drops. So yeah, back to the original topic. Yeah, I had my first opinion at Leeds Gender Clinic today. It went really well. I saw my care coordinator and Dr. Beanie, who is the specific doctor there, and we just basically talked a lot about what types of chest surgery there are, what types of lower surgery you can have, and we went more in depth about them as well. So for example, there are 2 types of chest surgery you can get. Well, there's probably more than 2 in fact, but the main ones are if you have a small chest, like an A cup for example, they can go in through the nipple and they can take the breast tissue out. Now, unluckily for me, I don't have a small chest, I have a large chest, which means they will probably make 2 incisions underneath the breast and basically chop everything off. It's the only way I can describe it. So I'll be left with 2 scars underneath the breast itself, the breasts rather itself. So that doesn't really faze me. I've already researched it all. I understand what can happen, the risks that you can get from having the surgery done, and things like that. Really, we talked about lower surgery. Now, for the transgender guys watching this, you will know a lot more about lower surgery. There's 2 types of lower surgery you can have. There's metodioplasty and then there's phalloplasty. Phalloplasty literally makes a real looking penis. Sorry, I'm getting all my words muddled up here. Basically what they do is they take a large chunk of skin either from your forearm or from your thigh and they make it into a phallus, and that's how they do it. The only difference with phalloplasty is the fact that it requires 3 or 4 surgical procedures, so you are in theatre 3 or 4 times, and from what my doctor was saying to me today, only 50% of people that do have phalloplasty are completely happy with what the outcome is. Now, metodioplasty is different. I am going to go into this, so please be aware that I am going into it pretty deep. Metodioplasty is where the clitoris grows and they make that into a penis, basically. So it's not a normal sized penis. It is pretty small, but it only requires 1 surgery, to pull the urethra through so that you can basically stand up and piss. That's the only way of saying it. But that only requires 1 surgical procedure. I have been swaying more towards metodioplasty simply because to me it's a lot simpler. Fine, you don't get the real looking penis, but at the end of the day you still have all the sensation and everything that you would have, even though the penis is a lot smaller. So sorry about the words used in that last couple of sentences. It's pretty difficult to explain it without saying the proper words. So yeah, we talked a lot about how life has changed this last year. So it's been 13 months since I first had my first appointment at Leeds Gender Clinic, and I can't actually believe how quickly time has gone. Sorry, this t-shirt is way too big for me. It's a bedtime t-shirt, by the way, so it's pretty huge on me. So yeah, it's been 13 months since my very first appointment at Leeds, and to be honest, I can't believe it. You know, I mean, my mum came to my appointment with me today, and it's just like, my mum came to my very first appointment with me back in October 2011. She met my care coordinator back then, and she met my care coordinator today, so it's pretty strange, to be honest. You know, 13 months down the line and we're talking about surgery, and it has gone pretty quick. We also talked about a hysterectomy, where they take the ovaries out, because the ovaries are, I believe, the organ that produces estrogen. So if you take the ovaries out, A, there's less chance of getting ovarian cancer, and B, it doesn't produce any estrogen. So basically I'll be estrogen free, which of course is what I want, even though the testosterone overrides the estrogen. It'd be nice not to have that in my body, to be honest. So yeah, that's all I can think of at the moment. So that was my first opinion today. The second opinion, I have decided I want to go private for, simply because on the NHS you are looking at a wait of 8 to 12 weeks for the second opinion. I think the ones that do it, the second opinions on the NHS, is Nottingham and Sheffield. Well, the one that I want to go to is Leicester. It's private, but if I'm seen, for example, by the end of November, maybe middle of December, then that is a lot quicker than waiting another 3 months. I think it's between £250 and £300 just for one consultation, which is probably what I would need. And to be honest, looking at it, that's a small fee to pay for the second opinion. You know, and at the end of the day, if it's going to cost, well, if it's going to cut the waiting times down by half, then, you know, even more than half, and then I'm willing to go for it completely. For the surgeon, for chest surgery, I want to go to Dr. Neeshaw, Mr. Neeshaw, and he's based in Hull. So it's not far from where I live, it's only a couple of hours drive. But yeah, and he has done a lot of transgender guys from, and probably even women, transgender women, from Leeds Gender Clinic, and I'm more than happy to go to him. So yeah, I mean, I can't really think of anything else to say on this video about today. Like I said, I am pretty knackered, so I probably have missed things out. It was a great day out for me and my mum. We enjoyed it. I did want to say a few more words as well about the 6-month video that I made. I did miss a few points out, and I have actually wrote them down on a post-it note. The one thing that I found tough coping with is the acne. I've got a lot of spots, even though you probably can't see them on camera. You can see a few of them there actually. I have got quite a few spots and dry skin, which is awful, to be honest. I mean, I understand that I'm probably going through the teenage years again, but it is pretty awful, to be honest, but there's no else I can do about it. If it's what I've got to go through it, I've got to go through it, and at the end of the day, I'm fine about that. Another big milestone is the fact that I've not actually had a period for 5.5 months, and that, do you know what, I just don't even miss it anymore. I don't even think of it. It doesn't even come into my mind. But when you think about it, you know, it's like no period for 5.5 months. It's pretty amazing, to be honest. I went to the gym this morning and I got my stats done from a personal trainer, and he did my stats at the very beginning of October, and I have actually lost 8.5 centimetres, which is about 4 inches from around my waist. Well, from my tummy button all the way around, from my belly button all the way around. So I just wanted to mention that, really. Sorry I've done that quick, just a few pointers there. I've got to go now because I'm running out of time. Take care everyone, and I'll see you in a bit.